give the word to Steve
Okay.
to conclude about what the U.S.
I'm going to do 20 minutes and 5 minutes. No, really. I'm just going to hit 2 or 3 points, I think, stimulated a little bit by your questions, but more by the presentations as well. Some of the lessons we take from the experience we've had working with our Spanish colleagues over the last couple of years. The first one is begin with your population. Begin with your patients. What are the needs in your country? What do you know about them? In most countries, about 5% of the population will account for the majority of your healthcare spending. Maybe 50, 60% of it will be that 5% of the population. And they are those of your fellow countrymen and women who have multiple chronic illness. And more importantly, if you have multiple chronic illness, one of them will be depression or some mental health. So you have to substratify by that. And then further, often it's the frail elderly. And we've had sessions here today, right, about dementia and Alzheimer's and so on. So it's the multi-chronic illness, it's the mental health, it's the frail elderly that you need to really stratify. And those are the ones that are going to, in particular, need well-coordinated, integrated care in the home and wherever, right, their care takes them. So that's the first point. You know, a corollary of that, which you may not agree with, resources are always constrained. You have to set priorities. So integrated care maybe isn't for everyone in your population, or is not needed, or where are you going to make your investments. So you want to be very prudent about where you're going to make the investments in having better integrated care. Second point is the personal health record, which again, some of our systems in the United States, they have them within their own medical group or, you know, hospital medical group system, but they can't talk to each other outside of that. Or the electronic health record that's in our physician offices doesn't quite match with the one in the hospital when those doctors hospitalize their patients. We're working on that. Progress is being made. So it's the interoperability of the medical record that's so important. And in Spain, they seem to have that. We have something called HIPAA, patient privacy. It's very important. It was developed a number of years ago, but perhaps we need some upgrading of that in order to allow for the greater sharing that needs to occur. So I think that's a second takeaway lesson. The third, really, some of the work in San Sebastian and elsewhere throughout Spain is around how do you get the integration of the health and social services, right? If you don't do it with the budget up front, can you do it after the fact through pooling or braiding or at the point of service, right? So people aren't fighting social services, housing, and so fighting with the healthcare system over, you know, who gets that money and so forth. So this is an issue. And so one of the lessons we've learned from Spain that we're incorporating into the U.S. to some extent is accountable communities for health. That's what we call them, accountable communities for health. And what they are is they're a interdisciplinary group of organizations in a community in which there's something we call a backbone organization, a central organization that's accountable for bringing together the local hospital and health system, the housing department, the transportation department, the school system, okay, community development agencies, the health department, of course, right? And they then look at the social service needs of this population. And one of their biggest challenges is, of course, building mutual respect and trust. They're working on that. But it's the data, again, it's the data exchange. And so one example, if you're interested in following up, is in San Diego, California. The county down there is relatively far advanced in this idea of the accountable community for health. And they have a 211 system in which anyone in the community presses that, and there's all kinds of resources that talk to each other, whatever that patient needs. I'm the primary care doctor. I can't keep in my head, my electronic health record doesn't work, 211, and they'll connect my patient. And I get the data back so I can follow them the next time. So those would be 3 lessons. We don't have enough time for more, but it's really the importance of stratification, of data and information exchange and visibility, and then recognizing that health depends much more on some of the things that Michael Marmot was talking about today than it does on the medical care system. We all recognize that. When you need medical care, you need it, you want it to be good, you want it to be coordinated, but we need to have those boundaries more permeable between our healthcare system and our social services system. So I think, Roberto, that would be my very quick summary.
Thank you.
Okay, thank you.